All right. Welcome to another episode of the Biorenewable Health Networks podcast. Today, again, we're going to be talking about how we got in our situation where we are and hopefully give you guys some ideas of how things work in medicine to help you understand why you need to be a part of non-medicine wellness, and also how to navigate the medical industry when you need it. Because again, like we've said before, we do need medicine, we do need health care, we do need sick care, especially emergency medicine. So we're not here saying that we don't need those guys. We're saying that let's understand how it came to be, how it works, and how we can kind of see ourselves out of it, for as much as we can, so that we need to use it for as little as we can. Remember, we talked about Richard Nixon back in the 60s and early 70s. He was, recorded as making his famous phrase of healthcare, where all the incentives are towards less medical care because the less care Kaiser Permanente gives, the more money they're going to make. Basically, that got him off the hook for providing national health insurance. But even if we look at it from the prospect of being a profitable business, is it actually better than other countries that have a national healthcare system or socialized medicine? Um, so on paper, if we look to places like Canada or the UK, and they seem to prioritize patients over profits, um, why does it seem like it costs less? And does it truly cost less? Well, what happens is that the costs are controlled through public funding. They're controlled through universal coverage, which means the government is negotiating the price paid to the actual provider. In doing so, it's like being Walmart. If I control all of the operation, well, then I can dictate the price, which means doctors don't make nearly as much money in those places as they would somewhere else. But you can always argue that doctors make too much money here, and that might be an okay thing. But what happens when you put control over the entire process with a government agency? Um, either way, whether it's, the health insurance companies dictating how much payment goes out, or whether it's the government dictating it, the consumer is kind of sheltered or insulated from the actual costs. So as a people, we don't know what's actually being paid in either system. And so when you're shielded from the true price of things, you don't actually know what they cost. And so someone can turn around and say, oh, well, you couldn't afford it, so we have to take care of it for you. And you fall for it because you don't know the actual numbers. Um, so that's what we're going to do today, is dig a little bit deeper, understand how the systems work, and see what the true costs are, what the true payments are, and how you're probably being duped into thinking that this is unaffordable for you and you should let somebody else take care of it for you. So for instance, let's talk about Canada, where they have a national healthcare system. And what they do to control the costs is they control how many specialists are often in an area. So let's say that you need a kidney transplant. Well, there might only be one nephrologist who does kidney transplants for an entire um, region. So um, let's say all of New Jersey has one kidney doctor. Well, guess what? You're going to have to get in line and wait. And hopefully, the wait isn't so long that you die waiting for your new kidney. So, resource allocation becomes a control mechanism of a national medicine, or a socialized medicine platform. They even have been known to say things like, oh, you need a heart transplant? Yeah, but you're too old. So we're not going to use it on you. We're going to give it to someone who's younger and needs it because you're already old and you're probably going to die soon anyway. Now, again, that's a fundamental problem. Do you really want a system that's deciding who gets what resources. Because Michael Moore made a movie called Sicko, and he grew up in Michigan, so he understands Michigan and Canada pretty well. And his movie described people in Michigan who didn't have health care driving across the border to get what they needed from Canadian doctors. One guy cut his fingers off with a saw, and he went across, and they said, "Oh, we'll put all your fingers back on." Didn't cost him anything. But in the United States, they were telling them that each finger had a dollar value. The index finger costs more because you do more with it. The pinky costs less because you don't do as much with it. And, the guy optimally asked for the ring finger so he could put his wedding band back on. But he only had so much money to pay, and so he couldn't afford to put his fingers back on. Whereas in Canada, they put them all back on. But what happens if you get there and they say, "Yeah, no, we don't want to use our resources on you." And that's a stark reminder of it all kind of depends on what side of the fence you're sitting on. Because the man who cuts off his fingers and doesn't have health care puts them on ice and takes them to Canada to have them all put back on. But the guy who needs a heart transplant and is put so far back on the wait list he's going to die before he gets one will drive across the border to the United States and pay for one. So both systems have their flaws. Both systems have their positives. And it's hard to believe that one system would work for an entire population of 300 million people just in our country alone, let alone, further out. Um, so we need to understand how our system works to understand how to play the system best. You wouldn't go into a basketball game and say, "Okay, give me the ball," and just start running around without knowing some of the rules. Now, they give you a packet when you get your insurance if you get it from your employer, and it's monstrous. I recently found out that the insurance packet they give me isn't the insurance packet they go by, because when I started asking questions, they were telling me that the answers were on page 52 and my policy only went up to 26. So where are you hiding these other, information tidbits that you're going to hold me up against? You don't even explain the rules to me. And so you have to understand how to ask questions, who to ask questions of. But understanding how the system was created is a good start. So remember, we talked about the Rockefellers basically stealing power and stealing the knowledge base, which then allowed them to create the AMA and fund it, which put them in charge of deciding who would be licensed as doctors, what schools would be licensed as institutions for training doctors. And so they basically stole all of medicine, which had naturopathic, it had homeopathic, it had chiropractic, it had food, and they turned it into purely allopathic medicines. And so as that system grew, there became manufacturers of medicine, there became suppliers of medicine, there became pharmacies to distribute medicine. And so after a while, some people got their politicians to say that, hey, that there needs to be something to help create a more affordable medicine delivery system. And so in the 1960s, they created an intermediary between the insurance companies, the suppliers, the manufacturers, and the consumer to try to keep the cost down. And they were called pharmacy benefit managers, or PBMs. Um, so the PBMs were set up to say, well, here's four different manufacturers of a drug or four different suppliers of a drug. And so if I manage the costs, I can buy from one or buy from another to deliver those products to my customers more affordable, which is a great system. It works in lots of places. It is the concept of Walmart. If I can stockpile and store it when it's cheap and deliver it to people, I can get away with having cheaper costs. And that was good for consumers or patients. But what did the insurance companies say? Well, wait a minute. Why don't we buy them out? And now the pharmacy benefit manager is a subsidiary of our company, and the profits that they make and the savings that they get will come back to us. So in the 1990s, companies like Medco and Caremark, excuse me, grew into bigger companies. And then they started consolidating. Companies like United Health bought Optimum RX, CVS acquired Caremark, Express Scripts went to Cigna. Now they all share each other's pharmacy benefit managers, but they're all within the insurance company. Now, if you are a company, a pharmacy benefit manager, and you are wholly owned by an insurance company, and you're supposed to be providing cheaper products to a customer, where is your loyalty? Is it for the customer? Is it for getting a cheaper product to the customer? Or is it for keeping the profits within the insurance company? Ah, so you're looking at a corporation decision that is in the best interest of the corporation, of course, but at the sacrifice of the customer, the person who's paying the premium on the policy. So we move into the 2000s, we move into the 2020s, and this is starting to be exposed um, by people like Brigham Buhler. You may have seen him on some podcasts. He was a pharmacy industry insider. He owned his own pharmacy. So he has seen the actual ways that the money goes. And he describes the pharmacy benefit managers as one of the biggest drivers of inflation for healthcare in America. And he goes to lay it out, and I'm going to try to do the same thing here to kind of show you how these rebates get thrown around and end up back in the pockets of the insurance company at a cost of higher costs for you. So if you want to look this up, Reuters and Market Watch have done some stories recently on them. The Federal Trade Commission has gotten involved because the three biggest PBMs are CVS, Caremark, Express Scripts, and Optimum RX. They control like 80% of the market, and so they can influence drug prices. And so now they're being investigated um, as to how to reduce the cost. But really, what they're not seeing is the reason why it's being down and how it's such a scam, um, and there's no way to stop it. Um, so, if you think about a pharmacy benefit manager today, again, they were supposed to be the middleman between the manufacturer or supplier and the customer. Now, what happens is the insurance company who collects their money from the employer and from the patient in terms of insurance premiums, then takes that money and they pay a wholesaler because the manufacturer stockpiles their drugs at a manufacturer or at a wholesaler. The wholesaler then distributes them to the pharmacies. The pharmacy benefit manager goes to all the different wholesalers and negotiates out some prices. Then they also go back to the manufacturer and ask for rebates or payments to sell their preferred product. That's right. The manufacturer will pay a pharmacy benefit manager a premium in order to have their drugs more sold than others. They tell you it's a generic, but really it means that it's just got a bigger rebate. They convince you that it's doing one thing, like there's less patents, there's less finance involved with it, it's an older drug, and therefore it's generic, so it's cheaper. And that may be part of the truth, but in the end, they're going to twist your arm so that you buy this version where they can get a rebate back in their own pocket. So let's say that the price of a drug is $100 and your copay for that drug would be $10. Your insurance would pay $90. But the pharmacy benefit manager has negotiated a price with the wholesaler to get it for less. So now the $90 that they would have paid is now $70. Then they go back to the manufacturer and say, hey, we have all these people that need this drug. How about giving us a rebate? And we're going to buy $10 million worth of this drug this year. Give us a rebate on it. And then they give them a rebate. Well, the pharmacy benefit manager takes the rebate. They don't pass it back to you. You still pay your $10 copay. And you still paid your premium for the insurance policy in the first place. So the manufacturer got paid from the wholesaler. The wholesaler distributed it all out. The pharmacy benefit manager asked for a rebate from the manufacturer because they're making millions and millions of dollars. And the insurance company just cut their $90 down to $50 or less. You're still on the hook for your copay. You're still on the hook for your rebate or for your insurance premium. You don't get the rebate. They don't even tell you there is one. So they're screwing you. And they're screwing you very well. And that's a very easy kind of system to set up if you're the insurance company, especially since the insurance companies learning from the AMA how to lobby Congress has gone in and passed laws about how insurance works and what they have to pay for and what you're allowed to sue them for. You know, they understood from Rockefeller that lobbying Congress is the best way to ensure that nobody will interfere with your business. Now, it's the reason why the French Revolution happened. You know, the government got in the way of the regular person through licenses and fees and regulations that made it impossible for anybody to do the same business as their friends who ran the businesses that made all the money. And now insurance companies lobby the crap out of the government to make sure that the rules are in their favor for the game they're playing. And the game they're playing is take your money and provide you with as little service as possible. Literally the words of Richard Nixon. So that's one thing if you need medicine. But now they're pushing it further and they're doing it. One of the things that didn't have any rebates or didn't have a way for an insurance company to reduce their costs was surgery. And now insurance companies are getting involved with how they can save money that way. You know, traditionally, if you needed a surgery, let's say for having a joint replacement or having a kidney replacement, something like that, the insurance company would have to make payments. They'd have to pay the surgery center. They'd have to pay the anesthesiologist. They'd have to pay the nursing staff. They'd have to pay the doctor who's doing the surgery. They'd have to pay for any follow-up care, any medicines that are needed, any therapies that you needed. And they would make all those payments. And if they ever denied payment, then you would call up your insurance and say, hey, what gives? I had this surgery recommended by my doctor, you approved it, and now you're trying not to make payment for it. So the insurance company said, how can we kind of work on that? And so what they said was, in the orthopedic world, hey, since you do so much follow-up and so much therapy, and it's such a pain in the ass to make these payments every week, 3 times a week, how about we just give you all the money up front and you pay everybody? That's right. Your insurance company now pays a 90-day supply of the money in one payment to the doctor. Then it's up to the doctor to pay the facility, the anesthesiologist, the prosthetic maker for an orthopedic surgery, and the therapist for any follow-ups. Well, now, if the doctor wants more money, he can't stop the surgery center. He can't stop the anesthesiologist. He has to use the product. What does he cut out? Cuts out some therapy. So now your doctor is telling you, well, you don't need the therapy. Do you question him? Do you go back and question the insurance company? Because the insurance company is now paying him less and less every year. And the only way for him to squeeze out the profits is to squeeze out the one thing that they can control, which is therapy, and say, you don't need it. But you don't question him. And you certainly don't go back to the insurance company and question them. No, because your doctor told you you didn't need it. But you do need it. And bundled payments is the way most of the things that the insurance company couldn't get rebates for is happening. We bundle all the services together to hide the fact that we're not paying enough for it. And again, it's no fault of greedy doctors, whether they're greedy or not greedy. The insurance pays them less every year. You don't go to work every year and get paid less every year, but they do. And so some of them are getting paid less now than they did 30 years ago for doing the exact same surgery. So a lot of doctors are stopping even doing surgeries, but they're getting squeezed. And so they have to run a business. They have to operate. So they have to make the money. And so they're just finding anywhere that they can cut back. But when your doctor cuts back and tells you, you don't fight them. You trusted them for their advice. And they're giving you advice based on financial incentives or disincentives provided by the insurance company. Again, win for the insurance company. So let's flash forward to today's day. In the news recently, we had this United Healthcare executive be shot in cold blood in New York City. And again, no one deserves to die. No one deserves to have their family suffer through a tragic loss like this. This is not something we're condoning. But let's look at the background story behind this, because not that this explains why it happened or what the excuse is for doing this terrible thing, but let's look at what was happening behind the scenes that this hopefully will expose and let the whole world realize that, again, not that it was condoned, but that this is what happens behind the scenes with insurance companies and how they're getting away with all of your money and there's no repercussions for it. Again, not that murder's a repercussion. I want to make sure that that's crystal clear. We're not condoning this. But let's see what happens. So if you guys can remember back in February of 24, earlier this year, there was this huge data breach at a healthcare subsidiary. And it was a subsidiary of United Healthcare. And over 100 million people's info was taken. And, it was going to result in all kinds of mess ups in payments to doctors. And it was going to potentially ruin people's privacy. All these great things happen. However, the attack happened in February, but was not announced until March. So what happened between February and March? Well, before the public knew about the information, some of the executives of United Healthcare started selling off their stock for millions of dollars. Now, they also are going to have to hire some kind of new cybersecurity company to help beef up their security in relation to this attack. So who do they look for? They look for a company named Palo Alto Networks, and that was a company whose stock options were being executed between February and March by Nancy Pelosi's husband. So, not that he's doing anything wrong, but knowing that this company is going to have to hire some other cybersecurity company, he starts loading up on the stock for that company, knowing damn well that they're going to get hired. Then March 14th, announcement goes out about the breach after all those people took their money. In May of 2024, one of the firefighter pension funds in Florida realized that happened, because sale of stock and execution of stock options are public information that have to be produced. And guess who runs pension funds? Really big pension companies. People like Jimmy Hoffa way back in the day, where they used to bully people and beat them up and run these pension funds, huge amounts of money. So these are very powerful people, and you don't like screwing with them, just like you don't like screwing with the mob. Well, the firefighter pension fund in Florida saw that happened, and they filed a lawsuit against United executives for fraud and insider trading. This would also implicate that Pelosi's husband was involved in insider trading. So we flash forward to a lone shooter who comes and kills the executive, who probably was going to have to say what he did. Now we get all mixed up in conspiracies and look over here, look at this guy. Who's this guy that shot him? Oh, he's a rich kid. His family owns nursing homes and has a whole pile of money in his house. And you name it, whatever the conspiracy theory is, whatever the story that's being dredged up is, what is it not doing? It's not drawing your attention to the fact that they're being sued for insider trading, for taking out the executive stock options and the stock sales before the announcement to the public that they had been breached. This is Wall Street at its finest, people. This happens all the time, and no one gets in trouble for it. Martha Stewart went to jail for insider trading. right? And you think it's because she knew the guy who ran the company. No, the guy who ran the company, his mother, his father, and his sister all sold much, much more money of their own stock in the days before Martha Stewart sold hers. So it's okay to do it if you own the company and you tell your sister and your mother and they sell for millions. But Martha Stewart does it and says, oh, no, 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 I didn't know. And she goes to jail. Yep, that's how these guys work. But let's look a step deeper of what this data breach really means. Regardless of what was going to happen for the insider trading, the data breach caused doctors to not get payments for weeks, if not months. I think they were talking about how up until June, payments to doctors weren't going to happen. I don't care how much money you have or how successful your business is or how much money a doctor has. You cannot run a doctor's office and pay staff salary and rent and all these supplies when you're not getting paid for 6 months. Maybe they can survive, but really with this dwindling of payments, and even just regularly, insurance payments take as much as 90 days to come through, and then they give you all this garbage about the paperwork wasn't filled out right, and anybody in medicine knows the games that they play. We didn't get the facts, or that person doesn't work here anymore, and you didn't submit the correct form, you got to submit it again, they don't answer the phone. Like it's all these BS little excuses. Which is why I always say when I grow up, I'm going to be an insurance company. I take your money right away, and then I just do whatever I can not to make payments. So that's what I want to be when I grow up. But I digress. So the cyber attacks resulted in a lack of payments for months. And as the doctors started struggling to run their businesses, who stepped in to save them? That's right. The insurance companies are now stepping in and telling doctors, if you are struggling, we will be the heroes and we'll make some payments and buy a portion of your practice to keep you afloat. Excuse me? The same insurance company who wasn't paying me now all of a sudden has money to pay me, but they want to buy stock in my company. They want to buy a portion of the company. Where they like the Shark Tank. You guys are coming in and taking a portion of my doctor's business. Just like the pharmacy benefit managers, if they're owned by the insurance company, whose loyalty do they have? Your doctor is now owned by the insurance company. Do you trust anything he's going to say from here on out? That it's in your best interest or in the financial interest of the business, which is owned by the insurance company? I mean, how much of a joke does it sound like to you? But that's where it's headed. So this is going to be the newest scam of the century in medicine. It's going to continue to keep happening this way. They're going to keep bleeding the doctors dry by delaying payments. They're going to do these little scams like this and then not pay them for months on end. And then when it comes time to pay them, they're going to say, oh, we don't have the money. And how about we just buy part of your business? And now the entire business is run by the insurance company. So what do? Well, just like everything else with Biorenewable Health Network, is we're here to give you the information. We're here to let you see the truth. We're here to let you see how the game is played. We're here to try to explain the rules, and we're here to show you the solutions that might be possible. Doesn't mean they're going to work for everybody, but some of the things you have to look out for if you're going to use sick care is you're going to have to understand your policy. You have to read it. I'm sorry. I know it's dozens of pages and it might not make sense. So contact us. We got people who read this stuff all the time. We understand it. We can help you walk through it. Understand that the medicine you're getting has a rebate and your insurance company is taking that from you. That's supposed to go to you, and it doesn't. Then try to advocate to your politician. They're in the pocket of the insurance companies because they throw lots of money and they're in their ear all the time. That's the important part. They're lobbying. They're constantly telling them, hey, this is good for people. This is good for your people. This is good for your constituency. No, the constituency needs to speak up. Write a letter. Call their office. Leave them a message. Tell them you're in wellness. Tell them you're in healthcare. Tell them this is garbage. you're not helping me, you're helping the corporations, the insurance companies, the pharmacies. You're not helping the people who you are supposed to represent. And that push is going to have to be for policies that regulate these guys and that tell them that they're not allowed to charge as much as they do. Now, again, I'm an economics guy. I understand that the free market system should work itself out. But once government regulation starts kicking in, it's not free anymore. So you have to fight offense with offense. You can't just play defense. If you only play defense, the best thing you can have is a 0-0 tie. You're not looking to score any points. So you have to push back to them and say, either don't vote for policies that represent the insurance companies or start voting for policies that represent us. You can also look into decentralized medicine. Other countries are starting this, places like El Salvador, where they're saying they're writing laws into their constitutions that say the government is not allowed to screw with medicine in any way, shape, or form. Medicine is up to the people to decide what's best for them and their health. And so decentralized medicine is not a socialized medicine central healthcare system. It's decentralized, meaning the government should have no say whatsoever in how I decide my health to be. So you can take these things to your Congress people. You can start talking to your doctor. Ask them questions. Why are you denying me therapy? Is it because you don't get paid for it? Is it because they don't pay? Who's paying for this? Call the insurance companies. Ask them lots of questions. They have people literally to answer the phone that will say they don't know, and you got to call this office and call that office. So you have to be pushy. And then, like always, share this podcast with your friends, your families, your loved ones. Let's keep on building a community that demands better from our healthcare system because the knowledge isn't just power, it's the path to wellness.